I was in our little kitchenette, and Bonnie came back and said, I'm going home early because I have a bad headache. As I was watching her walk away, she was walking toward the left like she was going into the wall. And I said, Bonnie, you walking into the wall. And she said, am I?
At that point, I was thinking this was stress or this was just being tired. I was planning to go to my granddaughter's wedding. This was very important.
Jackie came to get me saying that Bonnie was walking sideways down the hall. She said that she was concerned and to just come take a look at her. So I walked into Bonnie's office and she just looked like she did not feel well. Her face was a little bit pale. She said she seemed like she was weak on one side. So we started running through a fast stroke assessment. And when we asked Bonnie to hold her arms up, one of her arms fell ever so slightly. And that was what prompted us to say that this really looks like a stroke.
It was important for Bonnie to get here quickly after the onset of her symptoms so that we could administer the TPA in a window where it would still be efficient and possibly relieve all of the symptoms she was showing that day. So I believe she came to the emergency department within 30 minutes of the onset of the symptoms, and then before she had been in the department for an hour, we had already began administering the TPA.
Basically, when any stroke patient arrives, it's pretty much all hands on deck. You just want to determine if the patient has any contraindications to TPA. Every patient gets a CT of their head immediately, determine if there's any blood, and then some basic lab work to make sure there's no other contraindications.
Anytime a patient comes in to Medical City Arlington with new stroke symptoms, we call a code stroke. And what this does is activate a team of specialists. It alerts the physician that there's an emergency. It alerts the nurses to help each other. And it alerts the stroke coordinator, who's me, to be in the ED to help treat this patient. It's a full team approach.
We had just watched the stroke coordinator's video, but to actually see it happen to one of my co-workers, and I was able to aid her and getting her to the emergency room made me feel real good.
3 days after my stroke, I was able to attend my granddaughter's wedding.
To see Bonnie back to normal, able to come back to work, to be able to go to her granddaughter's wedding was amazing. It was huge.
I am so grateful to work with a team that is so dedicated and so compassionate. I could not be more thankful or grateful.